Hey guys, so I am back again and I have officially been working on my own as a registered respiratory therapist, RTRCP, for almost a month. I think about 4 weeks now. So I wanted to talk to you guys a little bit about some of the things that I've been doing that have helped me kind of find my own groove, and just a couple little tips. And also, if you stay tuned at the end of this video, there's going to be some information about a giveaway I'm doing on my Instagram page. If you want to head over there and check that out before you come back and finish this video, just head over to Instagram and my handle is @breatheeasy_RRT. So first things first, when you are new, you are slow. Just your pace is not the same as someone that's been doing it for 10, 15, 20 years, or even someone that's been doing it for 2 to 3 years. It's just something you kind of learn as time goes. So that means that your time management and prioritization have to be on point. You need to look at your patient list, see who your most critical patients are, and see who needs to be seen first. You want to be able to get to know those patients in case something happens. So general rule is, if your patient is declining in any way, or if your patient is being mechanically ventilated or on whether that's invasive or non-invasive, so whether it's actually with, a invasive mechanical ventilator or non-invasive such as BiPAP, CPAP, high flow, something of the sort that is not just standard oxygen, you need to see those patients first. Something else that also kind of helps me stay on track is I use my brain, or a sheet of paper that kind of, also gives you an idea of how many treatments you have, whether they're going to be every 4 hours, once a day, twice a day, and then it also tells you, where you have vents or other treatments such as chest physiotherapy or ABGs, things of that sort. So I actually use highlighters to color code that, and I try to stick with the same colors. So like, for example, if I have a vent in a room, I might use pink, and then if I have CPT on a patient scheduled, maybe I'll use green, and then my Q4s will be yellow, or just treatments separately. So you kind of find your own rhythm, and that's helped me because I can kind of quickly scan that paper and go, oh, there's pink here, I need to go to that room, I've got a vent there, or a high flow or a BiPAP or something that needs more attention, I need to go there first. So you'll kind of find little things that help you out as you go. That seemed to help me a lot. I got that from a couple of preceptors I had in the past, and my brain really does save me a lot of time. The second thing is, this might take a little bit more time, especially because you are new, but in first rounds, I try to completely review all of my patients' charts. This helps me feel more confident with my patients, and I want to make sure I have a thorough understanding of anything that's going on. So recent lab values, chest x-rays, notes from the previous therapist, or even just days before. So that if there are any trends going on with the patient, you can see that, as well as if something unfortunately ends to start happening where the patient starts declining, you are more well informed on that patient, and it's going to help you in your decision process a little bit later. And last but not least, ask for help. As a new grad, you don't know everything. I even had an experience the other day where therapists that have been on the floor for 20 years didn't know what the heck was going on with something that was happening. So never be scared to ask for help, whether it's because you don't understand something that's going on, or maybe you don't know how to use a piece of equipment, or you've just, kind of maybe got a situation where you need a second opinion. That's okay. Ask for help. Ask those questions. That's how you're going to learn. And in the end, it's not about us and our egos and feeling embarrassed because maybe we didn't know something or we weren't sure how to use something. It's about the patient and making sure that they get what they need. And as a new grad, people are going to not expect you to know everything. And yes, there's going to be people that maybe get frustrated, but they were a new grad at some point also. And that's something that you have to remember as you excel and as you get used to things and new grads start coming to you for questions when you're experienced. Remember that feeling of what it felt like to be nervous and scared and not know the answer to something, and to be scared to ask that question. Help them. That's really all it's about. And thankfully at my work, I've got some really great coworkers that even if I am not asking them questions, It's just kind of like the culture of the hospital, where once they're done with their rounds, if they are somewhere near me, they'll come and check with me and say, hey, what are you doing? Do you need help with anything? How are your rounds going? And vice versa. Although I can't do it as often as they do because I'm still, you know, not quite as fast as they are, of course, but if I happen to be done before they're done, I'll go talk to them and say, hey, what can I help you with? This isn't really a tip, but I definitely want to bring it up because I felt this and I get a lot of questions from you guys about not feeling confident. It does kind of go a little bit back to what I was just talking about, where, you know, maybe you're not as fast or you don't know all the answers, but as you go, you're going to gain more confidence. And don't get me wrong, I am not 100% confident yet. I've only been doing this by myself for a month, so I still have a lot of questions and a lot of self-doubt. But in the long run, that self-doubt is something that can be healthy in a way, because if you are unsure of how to do something, it drives you to learn how to do it properly. So anytime I have a question about something, or maybe a piece of equipment that I didn't really feel that comfortable using, either on my break or when I get home or on my day off, I will study it. And I will keep studying it until I feel confident. It might sound a little bit corny, but knowledge really is power, and how you make yourself feel comfortable with something is by confronting it over and over and over. Now, there's certain things we can't do that with in real life, you know, like I said, specific disease processes, or if you're not using a certain piece of equipment at that moment, but you can use all of your resources to make sure that you understand it a little bit better, whether that's YouTube videos, messing with the equipment in your equipment room, just get your hands on it and feel more comfortable, reading, studies, asking a coworker, messaging me, I guess, you know, if there's something I can help with. There are so many resources out there for you to use to help build that confidence, and it does take time and it can be really hard, but you have to keep working at it, because that's the only way you're going to start to feel comfortable with things, is if you force yourself to be in touch with it more, to get more comfortable. Sometimes we have to push those boundaries, and it can be hard, but it's doable. So enough of the tips. In my next video, I'm gonna do a quick little video maybe about flipping to night shift, because I'm actually getting ready to go into night shift right now. But I told you guys that I have a giveaway for you. So I recently just hit not only 200 posts on Instagram. I also, like I said, have been doing this on my own for about a month. One of my favorite things about education and learning is passing on information and materials you've used to other people that might need them. So hopefully you guys don't mind, but this is actually the respiratory notes that I used all throughout clinical. Now I use different apps and have a couple of other books I use, which I can share with you guys later, but this might be helpful for you guys that are still going to school or maybe starting clinical. Got everything from assessment, pharmacology, disease process, mechanical ventilation. It's got a little section for neonates and pediatrics, so it's actually really complete, and it's also waterproof. But I thought it would be fun to pass this on to you guys. And I'm not just gonna give you guys something that's used. I also actually snagged this WhiteCoat clipboard, and I use this all the time at work currently, and it just makes my life so much easier. Let me show you the one that I use, because this one's sealed. I actually bought this on Black Friday and got a good deal on it. I've been waiting to give it to you guys. I've just been sitting here like, when can I do this giveaway? I need a special something to do this giveaway. So all of these items were purchased by me. I'm not being sponsored by anybody. I'm still excited to be able to give you guys something. So I'll show you mine, since mine is open. And this is going to be the exact same way. You've got some basic values and things for weaning and lung volumes. And on the other side, you've got a little measurement section. This is probably the most helpful. It's got a section for ABGs and expected compensation, and we all know that that can be tough. But the one I got is in blackout, so it is a clipboard, but everything is completely black all the way through. And what I do on mine is, well, what I've started doing is I have little sticky notes that I'll just cover in tape if there's anything else, like we do bronchodilator protocols, and this tells me within how many hours or days that specific treatment needs to be reassessed because I don't have it in a quick access area. So I use this, you know, and the nice thing about this also is if you have your brain that I was talking about earlier, you can clip it to here, close it so that you don't have anything showing, and then it perfectly, here I'll show you guys because I'm actually wearing my scrubs for work, it perfectly fits in my pocket. It sticks out a little bit, but it does fit. Just believe me, it makes life so much easier. All right guys, so to enter this giveaway, head over to my Instagram. You need to be following me on Instagram, of course, and then tag one of your work or school friends. So that will get you in to win my previous respiratory therapy notes and a brand new WhiteCoat clipboard for respiratory therapists in the color Blackout. So go over there to enter, and there will be the full rules as well as when the giveaway ends and a couple of other bonus ways that you can maybe you know, enter. Some of those bonuses you can do now if you send me screenshots of being subscribed to my YouTube channel and a comment that you left on this video, and send those screenshots again to my Instagram profile. That will get you a bonus entry. As well as if you decide to post the giveaway that I'm posting on my Instagram on your personal Instagram stories, that will also get you a bonus entry to the giveaway. So make sure you go to my Instagram page, check out the rules for that, and that will also have the date that the giveaway will be ending as well as how it will be announced. All right guys, thank you so much again for tuning in, and I will see you next time.